few months ago, Australia looked to be on track to contain coronavirus. But despite 2 weeks back under lockdown, Melbourne's pandemic spike continues to grow.
This has been a more challenging wave to control. There's a lot of learning and reflection and watching closely what's happening here so that other states and territories can learn those lessons and learn how better to prepare.
If you do have any mild symptoms whatsoever, then it is important that you get tested.
The numbers paint an alarming picture. There were 403 new cases and 5 deaths overnight in Victoria. 40 people are in intensive care, with more than 3,000 active cases across the state. Masks are now mandatory in one of the nation's biggest cities, with police fining those who fail to comply.
What we've got at the moment is people who feel unwell but don't want to go and get tested.
Victorian Premier Daniel Andrews has issued a public appeal for people to follow the rules around self-isolation before and after testing.
53% of them are not isolating.
I think that there is some confusion out there in the public. People are told they don't have to isolate until their test is positive, and that was an earlier recommendation. If you have symptoms, you really should self-isolate until you have a test and then until you have the result of that test.
Well, I think people know and understand the rules. I think that there'd be a very small number of people who could actually, when pulled up and asked why they were doing something that was clearly against the rules, would be able to convince anyone that they didn't know about the rules. Like, this has gone on for months. I think it's fair to say there are many, many people who are working when they shouldn't be.
One reason for the lack of compliance is thought to be the number of people in insecure or casual work. The state government is trying to combat that by offering a $300 payment to anyone who has to take a test and isolate but doesn't have sick leave.
The situation in Victoria is, I would say, time critical. We have a very short length of time to get this right before our numbers increase more dramatically. Then that'll be it. Okay?
Dr Mukesh Haikawal has been on the front line of this pandemic, testing hundreds of patients a week at his clinic in Melbourne's southwest. Says there's confusion among the community.
Many good people are coming and getting tested, but don't understand that they have to self-isolate for at least 7 days after that test.
Hey mate, can I borrow your finger? Sure.
He's been writing to Victorian authorities calling for better messaging, saying communication to the public and health practitioners about when to isolate before and after testing has been unclear.
I've got the joyous task of doing your swab today. Excellent.
The messaging has been inconsistent. Inconsistent because when we do testing in our place, we've got a certain mandate from the federal government and the governance, which says 7 days isolation because you're deemed to have COVID until you leave here. We've had a whole lot of testing going on alongside that, for people that say, go test and go back to work. That to me is something that needs clarification. Why? We've had people who are told isolate for 14 days.
He's also urging everyone to take personal responsibility to halt the spread of the virus.
This is a health emergency. It's become a health emergency in Victoria. It may well be in the rest of the country. Let's do the right thing. Let's lock down. Let's make sure we got the right advice, and let's get the communications happening so we give good guidance to our population.
What we're really trying to get to is a point where we can have a sort of sustainable state where we don't have to go in and out of lockdown, because that is so damaging.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.